and welcome to another installment of Wheezy Wednesdays. So today I'm going to talk about something that is near and dear to my heart and is the passion for my future career, and that's the patient experience. We always focus on patient satisfaction and optimal outcomes, quality and safety of nursing practice, but what about the actual patient? Yes, it's one thing to have a good outcome, but are we tailoring to their needs? Are we actually giving them the experience that they would want? So I have discussed a few times today about improving the patient experience on my Twitter, and I was giving different tips, and I just want to go over those and add in a few of my experiences at work, some examples of things that I've done and the difference that it's made. Now, most of you are going to think that these are very basic. You should be being nice to your patients. You need to give them optimal care. But you'd be surprised as to how often these do not occur. All right, so here we go. Tip number 1, remaining impartial. So you receive a report sheet, you receive someone's chart, you're going to review it before you receive a patient from the ED, from the PACU, OR, whatever it is. So as you're going through, you're seeing that patient's most vulnerable moments, whether they were medically compromised, you're seeing their pertinent history, sometimes you're seeing their background, you're reading about crimes that they've committed, you're reading about their drug history and polysubstance abuse, you're reading about rehab or inpatient psych admissions, you're reading a lot of things that you probably wouldn't have known if you just did a full assessment on your patient. So at that point in time, you're reading things that will never be expunged from someone's record. Their flaws, their failures. And to know that before you're walking into a patient room, you can become jaded. You see that they were in prison for 12 years. You walk in, there's tons of prison tattoos and this rough and tough guy. You automatically assume that he's not going to be compliant. You automatically assume that he's not going to be nice, that he's going to give you attitude. But why? Why? So I had a patient, and he had a history of substance abuse. And I knew this walking in, and I knew everything about his history. But I got to know the patient. Go figure, right? I learned about how he's volunteering, about how he's trying to give back to his community, how he's been clean for 6 years. I mean, do you really think that you would have read that in the chart? Do you think that someone would have asked about his history, asked about his professional work to do better for the community? Probably not. I also used to work in psych and in corrections, and especially in corrections, you have access to their chart to read their crime. I never read it. I didn't want to know. The only reason I would want to know pertinent information like that is if I was possibly going to be harmed. If there was someone that had such crimes that they are deemed to not be in contact with women, I would need to know to give them to a male provider, that I could not take care of them safely. That's the only time I want to know. Other than that, I don't care what you did. I don't care where you come from. I don't care who you are, what you are. I care about your medical issue at this point in time. That's it. I'm going to give you the same care. I'm going to give you the best care. But it's because I'm not letting anything affect my judgment. I'm focusing on what you need right now. Remain impartial. Achoo! Tip 2. To know your patients. Building a rapport and valuing a nurse-patient relationship, it can take you far beyond just checking the boxes on your nursing task list. It's ridiculous if you don't understand your patients. You need to get an assessment anyway, and why not ask where they're from? Ask what they like to do. Oh, You like to hike? When was the last time you went hiking? 2 days ago, you say? And then you were admitted. So you have stroke workup things going on because of your facial droop. Should we be doing Lyme labs? Maybe. You can get a better assessment. You can better critically assess your patient. You can understand their background, and you can understand them as a human being. Not only do human beings deserve dignity and respect, but you need to listen to their expressed needs. You need to understand that patients have power and they can advocate for themselves, and then it's your job as a nurse to advocate for the best for them, for the treatment team. But they come first. Tip 3. Hourly rounding, and I think this is huge. Hourly rounding not only ensures your patients that they're being taken care of, that there is constant and consistent help when they need it. It makes them feel safe. It makes them feel assured that you do care, but it reduces alarm fatigue, because if you're reliable and within the first few hours of your shift, you're going in every hour on the hour, whether it's 10 minutes before, 10 minutes after, you're proving to your patient that you'll be there, they're going to wait. You know what? Nurse is going to be here in probably about 10, 15 minutes. I need something. I'm going to wait to press my button. I'm going to wait until she comes in here because she's proven to me that she can be reliable. So why should I press my button right now when I know that she'll be in? You're reducing alarm fatigue. You're reducing the amount of call bells that are used on your unit. Hourly rounding ensures safe patient care. Faux. I'm not good at this one at all, but incorporating humor. Be funny. Treat people like they're real. Tell a joke. Just be understanding by treating them like they are a human. You know what? I have 22 minutes left on a PCA for one of my patients. He's writhing in pain. What do? I sit down by that bedside for 22 minutes. Wow, it's a lot of time. Who cares? That patient is crying and writhing in pain. He's got the acute pain service on already, and they don't want to adjust the settings. He can't have his settings adjusted, so he can't get anything. He has to wait for that bolus dose. So I took out every joke in my arsenal of humor. I have him laughing over his tears of pain. And then all of a sudden, 22 minutes passed. Press your button. You're good. Do you realize how grateful he was to just have someone there distracting him and engaging him in conversation and telling him these jokes? I can't say they were all funny, but it got him to listen and to somehow put that pain in the back of his mind. He could be distracted and redirected for that short period of time and make it through those 22 minutes. So it made it worthwhile for him. It didn't control his pain, and I had to rediscuss the pain and the PCA doses with the team, but for those 22 crucial minutes, I made a difference. And I could tell I made a difference. I'm sure I could add 10, 15 more points, but these are crucial. Having dignity and respect for your patients, listening and understanding their needs, incorporating humor, getting to know who they are as a person, building that rapport with your patients. Hourly rounding, huge. Reduces everyone's stress level, patient and nurse. Just try to improve that patient experience. Try to make that difference in any little way that you can. One more patient story. I had a 22-year-old patient. She was in for rule-out nucleo. She had a grand mal seizure, came into the hospital. She is so scared, so uncomfortable. So I made a paper airplane, and I threw it at her, 10:30 at night. And it said, "Sleep well, love me." She cried. As she's rolling down to the OR later the next day, she tells her family, "Don't throw out my paper airplane." One paper airplane. Took me 2 seconds to fold and write on it. So when she got back and she was in the ICU upon her return, I went over to her family in the waiting room and I had them all write notes on pieces of paper and then fold them into individual airplanes. So I went in and I had a fleet of airplanes that I'm tossing, and she's crying, her mom's crying, her dad's crying. I listened and I cared and I incorporated the family, and it made the biggest difference just to see the smile on their faces. You can do it. It's easy. Take 10 more minutes. and improve that patient experience.